Hello everybody and welcome to NQA's webinar on ISO 45003. Just to give you a brief introduction, I'm Terry Fisher, the Principal Assessor for OH&S systems within NQA. So welcome to the webinar. Obviously today we're going to look through the requirements of and give you an overview of the introduction for 45003, which was published last year in June. But I'll just go through some marketing and promotion stuff just to reinforce who NQA are. So NQA is a world-leading certification body with a global presence covering numerous requirements and operations. So NQA specializes in certification in high technology and engineering sectors, and as you can see through the screen, we've got a global presence and number one, and we're in the top ranking certification bodies from a global perspective. We provide a range of certification services and training services, including quality, health and safety, environmental management, aerospace, food safety, etc., information resilience, and information security. So there's a whole range of packages there available for our clients and customers and future clients and customers. We also cover a whole load of training packages in terms of virtual learning, e-learning and live webinars, as similar to today. We can do in-house training and public training nationwide throughout the UK, etc. So whatever you need, come and talk to us, and if we can help you, we'll make the arrangements. So as a brief overview, sorry about the picture, etc. You have to, that I like to frighten people first thing in the afternoon and wake people up after lunch, keep them entertained. So the duration of the webinar is approximately 45 minutes. There is a question box to which you can ask questions throughout the webinar. We'll either run through the questions as they come up, depending on the theme and the nature of the questions, and there'll also be a Q&A at the end. Just as a guide to questions, it's difficult for us to answer individual organisational questions. We can clarify what the management systems and standards are looking at, but we can't necessarily consult. We're not permitted to consult, so we can't give you direct answers to individual organisational questions unless it relates to generic system or management system questions. We will be recording the webinar and making that available publicly. And to all of you that have registered, we will be sending out the slides and the various information on how you can listen back to the webinar should you need to. So it's good for sharing with clients and colleagues, etc. And just to reassure you, you'll get all the slides as well. So you've got the supporting information. What we're looking to for you to learn this afternoon is the history and structure of ISO 45003, some terms used within the standards, and also an overview and introduction of the requirements of the standards and the application of the ISO system and guidance elements that 45003 relates to, and how it interlinks with ISO 45001, which is the primary occupational health and safety management system that you need to have in place to utilise fully the 45003 requirements and guidance. So in terms of ISO 45003, it's a guidance standard, so it's not the same as ISO 45001. ISO 45001 is a full-blown ISO approved management system standard, and 45003 is a guidance standard relating to the focusing on managing psychosocial risks within occupational health and safety within organisations. So it's a supplementary guidance standard for existing 45001 system users. So in principle, what we've got there, ISO 45003, the history and development, the aim of the and the intended outcomes of any occupational health and safety management system, i.e. 45001, is to prevent work-related injury and ill health to workers and to provide safe and healthy workplaces. 45003 is intended to supplement 45001 and focus on the requirements relating to psychosocial risk or health and well-being, etc., as is the more common phrase certainly used within the UK. Consequently, it's critically important that organisations eliminate hazards, etc., as they go through the development of their systems and the implementation of the various standard requirements, and also looking at the effective management of risks generally. So 45003 isn't introducing any new principles there, it's just enhancing the focus on health and well-being within society and general within the workplace. Psychosocial hazards and risks are increasingly recognised as major challenges to health and safety and well-being at work. 45003 cannot work or be implemented in an organisation without the structure and requirements of 45001. Because it is a guidance standard, so you can't have an accredited certificate to 45003 because it's the requirements of 45001 that enable 45003 to be implemented. It's there to enhance that performance of psychosocial risks and was published in about June 2021. So it's a while back now, but it's becoming increasingly important to organisations to use the vehicles of the ISO management system structure to develop and improve health and well-being within the organisations. The term psychosocial risk is a standard term that's used within the standards, but more commonly, health and well-being is the phrase that's generally used within organisations within the UK. So, as I've said, the standard of 5003 gives guidelines for managing the risks within occupational health and safety management system. It enables organisations to prevent work, etc., and ill health to workers and interested parties, and to promote well-being at work. So that's what it's intended to deliver as part of the requirements of the standard. It's applicable to all organisations of all sizes for development and implementation and maintenance, etc., and the continual improvement of health and safe workplaces. The structure of ISO 45003 follows the ANNEX SL format, and although it follows that almost line for line in terms of the various things, the clause requirements themselves can differ slightly and the wording can differ. And it also, because it's a guidance standard, also includes examples for people to follow and use to give them some guidance and support in how to make most use of their existing management system format. It does add the occasional additional clause such as 8.3, rehabilitation and return to work, etc. And there are terms and various things used within the standard that so you can use the various phrases, so psychosocial risks and psychological health, mental health, etc. And as the phrase there, although all these terms are in the standard, psychological health and mental health ineffectively are interchangeable terms. Certainly mental health is a more common phrase used within industry and practice, certainly within the UK. So it's about it's not always about the terminology used, it's about understanding what it means and what it's trying to deliver. The main thing is we're looking at all types of impacts on health and safety and well-being at work. That's the key element of what we're trying to deliver here. So in terms of terms and definitions, the psychosocial risk is defined within the guidance standard as a combination of likelihood of occurrence of exposure to work-related hazards of a psychosocial nature and the severity of the injury or ill health that can be caused by these hazards. So that's a relatively common risk process in terms of risk assessment and understanding how risk is assessed and evaluated. Hazards of a psychosocial nature include aspects of work, social factors, the work environment, equipment, hazards within the tasks, also things like workflow, etc., etc. So there's a whole range of things that can impact on somebody's psychosocial risk profile. And well-being at work is looking at the fulfillment of mental, physical, social, cognitive needs of workers and interested parties in relation to work. Now, so the organisation can obviously, in terms of a management system, it's looking at things that it does in a systematic way for all the workers across the organisation. Then it's using evidence of how that's deployed across the organisation to confirm that it's effective. Individual workers and individual people will all have independent and individual needs in relation to their well-being and their circumstances. So it's about what we can do in a systematic way across the whole of organisations to help and support the myriad of needs and requirements of our workers whilst in the workplace. The well-being at work can also contribute to the quality of life outside work and vice versa. The quality of life outside work can impact on the well-being of somebody at work. So it's not about the organisation taking whole responsibility for everything. It's about understanding how we can support workers in the work environment and have systematic support mechanisms and cultures and arrangements in place, etc., to help minimise those risks in relation to occupational activity. And it says there, well-being at work relates to all aspects of working life, including work organisation, the social factors at work, so whether people are feeling isolated, alienated, etc., the work environment, equipment hazards, and hazardous task activities, etc. So it's the whole myriad of all those various things of how people feel, how people react, and the pressures that work can bring about on individuals. And the same pressures, individuals don't always react in the same way to the same levels of pressures. Some people are more adept or more suited for certain types of tasks, etc. So it really is about trying to look at the mechanisms and the way we work and make that productive across the organisation. So system structures and requirements. As I mentioned briefly earlier, ISO 45003 follows the existing ANNEX SL structure with regard to sections and clauses. So section 4 looks at the context of the organisation. Section 5, leadership and worker participation. Section 6 is planning, assessments and objectives and risk evaluation, etc. Section 7 is support mechanisms, resources, competence, make sure people are trained, awareness, communication, and documented information. Section 8 is operational planning and control. Section 9 is performance evaluation, including internal audits and management reviews, etc. And Section 10 is the improvement processes. So although the structure is very familiar, because this is a guidance standard, it doesn't always define close requirements in terms of what needs to be achieved. It also gives you examples of what to consider in relation to achieving the requirements. So the standard itself actually has quite a lot of examples in there in terms of things to consider, you know, the geographics and demographics of the workforce, where you're recruiting the workforce from, the cultural differences of workforces. If you're an international organisation, have workforces in different geographical locations, the cultural differences, the language changes, etc., can be quite diverse. And it's about trying to utilise that most appropriately for that group of workers in those locations. So organisations do need to be quite dynamic and flexible in how they do things, because one thing in one culture can be perfectly acceptable, whereas in another culture it may not be. So it's all about making sure that whatever we put in place is effective in delivering the requirements of the business and meeting the needs of the workers and not exposing them to unnecessary or unacceptable levels of risk, which can all contribute to the health and well-being of workers within organisations. So although it's using the management system principles, it is very much a people-focused guidance document, like I say, with a lot of support and information within the standard to help you implement that within your own workplaces. The benefits of ISO 45003. So although it's relatively new guidance, it's aimed at reducing the negative outcomes for workers, which can include all sorts of things and associated conditions and behaviours, as well as reduced job satisfaction, lower levels of commitment and productivity. So you can argue that a happy and engaged workforce is also generally a more motivated and more productive workforce, and generally more flexible in their approach, and it's a nice place to be in terms of worker relationship within the organisation. So there is good business sense in terms of investing time and effort and resources in ensuring that workers are suitably protected and feel valued and motivated, etc., within their work environment. As I say, the delivery of 45003 can include improved job satisfaction and therefore increased productivity. So it is applied common sense in terms of effectiveness. There is a commercial benefit to retaining a motivated, productive workforce, especially in times where there are labour shortages, etc., or you can have difficulty getting specialist skills, etc. So the investment in occupational and mental health, etc., and well-being within the organisation should be seen as an investment and not a cost. It should actually develop a positive approach to the workforce, and then it should provide benefits for the organisation in terms of returns from that workforce. The guidelines give examples of indicators relating to staff behaviours and changes, etc. So you can see there's all sorts of things there in terms of where workers might require some form of organisational support or changes to existing arrangements and practices, which is very important. The success of the psychosocial risk management depends on commitment from all levels and functions of an organisation. So it isn't just a management activity. It's everybody within an organisation can contribute to a positive healthy and well-being culture within an organisation. So it isn't just a management activity. It could be just as simple as saying hello to somebody and recognising, saying hello, good morning, passing the time of day. and just engaging with people, because that prevents a lot of isolation from certain individuals. So we've got a question here. Does an organisation need to be certified to ISO 45003 if they are certified to 45001? No, it's not a mandatory requirement to use 45003, but 45003 uses 45001. So if you've got 45001 in place, you should not be ignoring the psychosocial risks that can be posed to an individual, which can include stress and pressure and anxiety and various things at work. So that it's just enhancing now those that focus on those within the existing 45001 requirements. We've got to protect workers from psychosocial risk existing within 45001. So therefore, that's why 45001 is the primary delivery, and 45003 is a supplementary ISO guidance document to help using that existing 45001 framework. Also, the next part of the question asks, is 45001 sufficient, or during audits, do we get audited on the guidance? It all depends on the performance within your organisation in terms of, so we should, in all 45001 external audits, be looking at occupational health and well-being. So it depends on what the indicators are within the system as to what degree we look at in terms of, but we should be looking at occupational health and safety, and we should be looking at things like absenteeism and various things like that in terms of how that can be an indicator that you may have problems. Because if you've got frequent absences or etc., other than long-term medical conditions, etc., if there's trends in terms of absence management, in terms of pressure or stress or anxiety and various things, which may be related to occupational activity, then that would fall under the remit of 45001. And it should be included appropriately based on the level of impact to the organisation and the level of impact to the individuals. So you can use 45001's existing arrangements to cover the requirements of psychosocial needs. There's no mandated requirement to use ISO 45003. This is a guidance standard, but it gives you some very good examples as to what you can consider and help you enhance the existing requirements within an organisation where appropriate. So it's there as a supporting document more than an accredited document. I hope that answers some of those questions. 45,000. The question here is ISO 45003 certification not available to organisations? How can organisations be audited for it? But they can audit themselves for it. Is the first answer to that, Mary. So as part of your management responsibilities within your 45001, you can look at auditing your various requirements for mental health and well-being and the way that works. And NQA as a body does offer unaccredited certification to the requirements of 45003. I say unaccredited because it's not UCAS accredited and it can't be included in your scope of registration within an accredited management system scope of registration. So you can have an external verification process for your 45003, which is unaccredited, but you can't include the requirements specifically in your scope of registration on your ISO 45001 certificate. So I think that should answer Also got a question here about do we have to do individual psychosocial or psychological risk analysis? Is it feasible? No, it's not about becoming a psychoanalyst or anything like that. It's looking at what is going on within your organization, looking at the indicators within your organization, things like absenteeism, general culture, general attitudes of staff, etc., general departments, even down to processes. You'll be aware of changes and various things within, so you look at those arrangements in terms of your internal organization and to see whether actually there's something changed. Is something deteriorating? Is something improving? Has there been a change of leadership? Has there been a change of work staff, etc., that can change the dynamics and the structure and flow within an individual department? So we're not asking organisations to do psychological risk profiling or in that nature, but we are asking them to consider that in relation to the systematic things that an organisation does, how it can contribute to that, and it should make considerations to people's mental health and well-being, because you know your staff and your arrangements far better than us, and you should make those as part of your planning and process activities in relation to ensuring that any risk is minimised or reduced. Next question that we've got here, would it require more audit time if 45,003 is being added to the scope? In principle, it would be added to the assessment duration and it would need additional time. But you can't add it to your scope of registration to your 45,001. So getting back to the presentation, thank you for all of you that asked those questions. So psychological health needs to be brought on par with physical health. I think most organisations, certainly within the UK and globally, would agree that I think when we talk about health and safety, we fundamentally, a natural trait up to this point has been looking at the physical safety of individuals, and health has been considered in relation to things that can cause harm, etc., in terms of physical harm, such as noise and vibration. So it's about bringing health and psychological health on a level playing field with that physical health. I think it's widely recognised today as a society we need to get better at this, and effectively addressing mental health issues is a core requirement about looking after people. I think it's particularly important in the workplace because of the amount of time we spend in the workplace. Most people spend more time in the workplace than they may with their partners during their working life, etc., etc. So, you know, it really is an important time that we use effectively and make sure that we protect people from undesirable risk. It's also beneficial for organisations to understand and develop and utilise various methods and information and support their workers by considering aspects such as the way work is organised, along with training and awareness for workers to aid recognition of hazards and aid recognition of changes within individuals, and where appropriate, implement risk reductions and actions and various things as we're going through. It really is a lot about relationships and communication within workplaces. They are small communities, or even quite large communities, and it's quite astounding how much information is there. And work colleagues can say, "Oh, I noticed that somebody was not quite the same. There's been a change in the personalities. There's been this happening and that happening," and and a lot of support can be provided by the colleagues on an informal basis, like I say, just by having somebody to talk to and just saying good morning to, etc. So there's a great deal of things that can go on in an informal way to improve the culture within organisations. So, in terms of system development, when you're looking at 45,003, the system should be developed to support workers to reduce risk and enhance well-being. And this should be underpinned by a supportive organisational culture and commitment. Things that can be included there are employee assistance programs, worker awareness training for all levels, and I deliberately say all levels because it isn't just aimed at sort of supervisors, team leaders, managers, etc. It's about everybody within that workforce. We can all play a part to contributing to good health and well-being within the organisation. Worker representatives and worker engagement initiatives are really brilliantly effective when they're done well, and they can be a good starting point to find out how do you know what the workers would need. Well, let's start talking and communicating with the workers and the workers representatives and getting some engagement there to make whatever we do effective and beneficial for everybody. It includes regular and effective communication methods. Now, that can vary depending on who the individuals are, what working groups they're in, etc., etc. So, you know, as with most ISO standards, it's not overly prescriptive. It's talking about you use your organizational knowledge to best effect and put appropriate methods in place for the various work groups and communities that you've got within your organization. It could involve flexible working practices in terms of, you know, remote working, hybrid working, working from home, how many, you know, etc., etc., attending sites, etc., all these things. Clear job roles are really important. People need to understand what their expectations are on them, and the company need to communicate, you know, the expectations of what the individuals and workers can expect from the organisation. So it is about that clear expectations and roles. Provision of suitable resources, which also includes time. I think sometimes time gets overlooked very easily, but you need time to do these things. You need time to do your job. You need time to do your job well. And you also need time to communicate with others to ensure that what you're doing is effective. And it's also about having time to learn from others and various things. So it's all about this communication and engagement with workers at all levels. Some of the concerns about engaging with workers can include worries about pushback and negative attitudes and various things. So it's also about using the right people at the appropriate levels and the appropriate skills. And it might not be academic skills, it can be social skills, it can be the people with the right temperament, etc. All these things can be considered in terms of job roles and activities and support functions, etc. So it's really important to consider all of those. A lot of the problems that come could be based on historical legacy issues that may have come from unsuccessful previous initiatives. And for these reasons, care should be taken to consider concerns of workers and other interested parties in establishing things before you implement them. So think about what you're doing, talk to workers prior to implementation, get feedback on whether they think it's the right thing. It's a collective activity is developing the system, and it isn't just down to, you know, a high-level manager within an organization. Everybody can contribute effectively to developing systems and making suggestions and participating and engaging with that system. So it really is important to keep these communication lines really open. And as I said earlier, support can be informal as well as formal. So a lot of support can be provided by work colleagues, etc., without going through formal methods of support functions and employee assistance programs or whatever. A great deal can be done in an informal nature. The organisation should prioritise actions based on its assessments and its evaluation of psychosocial risks within the organisation. And there may be data and information and various things, like we talked briefly before about absenteeism or attitude to work or deteriorating work rates. All these things can all be indicators of something changing within either for that individual or within that department or within that function of the organisation. And they can all be indicators of things, let's say, changing. So those indicators and that information should be used effectively within the management system. We want to reduce psychosocial hazards so people aren't under undue stress and pressure. We want to prevent injury and ill health in the long term for everybody. We also want to identify areas for improvement, including promotion of wellbeing at work, and that can be best done by talking to each other and engaging with people at work and finding out what's appropriate for them. It's also important to include strategies for workers returning to work. So they may have had some reason to be away from work, which may not have been necessarily occupational. It could have been, you know, domestic circumstances or a bereavement or something like that. And we want to encourage a supporting strategy for workers returning to work. So that's appropriate for the various individuals, etc. So it's about organisations being empathetic and listening to workers, and where appropriate, putting in suitable support and various things that can aid that return to work for workers. And it's also important to remember that workers have responsibilities for both themselves and for others to provide a positive and culture for well-being at work. So it isn't just down to the organisation to do these things and the people with responsibilities within that organisation, but individuals themselves have responsibilities to look after themselves and make an effort. And where there are processes and things to be done to aid these things, try engaging with them if you need to, you know, things like occupational health, employee assistance programs, etc., can often include counselling activities, etc., related to financial support or various things like that. So there's all sorts of mechanisms there that can help reduce and improve mental health and well-being. Not necessarily directly work related, but you should engage with those support mechanisms where appropriate, and you know, individuals have that responsibility to help themselves where appropriate. So there we go. We're also running an ISO implementation guide for 45003. It won't be myself, it'll be my colleague Claire Harling. We'll be doing that on the 9th of September at 11 AM British summertime. And for those of you who want to continue your journey in understanding more about 45003, I hope you found this initial introduction useful. Hopefully it's given you some answers to some of your questions. I don't, in 40 minutes, I don't profess to have covered all requirements or gone into any great depth as to what it can mean to various organisations. I hope it's given you a flavour for that. Like I say, the next webinar that we're doing is a guide to implementation for that date. So make a note of that. And in the same way as this webinar, it will be available to all registered parties and it'll be recorded, etc. And the registration for the website is there, so you can register using that. Are there any other questions that people need answering before we draw close to this webinar? you've got any questions, type them in now. We've got a few minutes that we may be able to answer some questions or some straightforward, clarify some points. If you do need any support from NQA, by all means, contact NQA directly, or if you need any clarification on what we've discussed, by all means, email me. I'm Terry Fisher at nqa.com if you've got any specific questions or clarity that you need. If not, you can send inquiries or points to my colleagues at NQA head office, and if they need my support in answering any of their questions, we can do that. It helps to get your feedback on questions or points of clarity, because it helps us create future webinars, etc., based on themes or anything that you need. So if there is any burning issues, not just on occupational health and safety, but in things in general, if you want to then add that in, by all means, send us some feedback and let us know what you need. There's a question here about will the courts in the UK use ISO 45003 guidance on cases of breaches to the Health and Safety Act? No, it's 45003 is not a mandatory requirement for organisations. It's enhancing the existing management system requirements, and the management system requirements are there to help you deliver your compliance requirements within the organisation. I think 45003 is really an enhancement to 45001, and it wouldn't be used as you're in breach of clause X, Y, or Z, unless it was proven that there was under the requirements of the Health and Safety at Work Act, where you then neglected to do it. But ISO 45003 isn't a mandatory requirement for organisations, and any prosecution or breach from an enforcement regulator would come from the actual legal requirements of the Health and Safety at Work Act itself. The link to the next 45003 implementation webinar will be sent out with these slides, just to clarify. So when you get the slides, everybody who's registered today will get a copy of these slides that I've used today, and therefore the link will be also included in that. I can't see any additional. There's a question about should mental health first aid incidents be included and recorded, etc. It can be a very sensitive area, recording the levels of episodes and information, and it can also, you need to look at how the organisation or how your organisation looks at GDPR, in the same way it maintains occupational health records. Really, it comes under the same remit as that. So, like I say, a lot of the support mechanisms that organisations, certainly through employee assistance programs, they will feed back to an organisation that they've had a number of users, for want of a better term, but they then won't feed back those individuals and the details of what the nature of the use was. So generally, the confidentiality of these things is kept in between the provider and the person using the service, as it is with doctors and various other things. It's very much not just a trust issue, but there are legal implications in terms of breaches of medical confidentiality, etc. And mental health activity and operations can be deemed in that way when it comes to occupational health. So I can't see that anybody's. A quick question on 45003 guidance is going to become even more important as the UK enters a period of very high inflation. I think there's a lot of things within the UK in terms of labour availability and being able to recruit and various things that health and well-being within an organization and having good systems and good support mechanisms within an organization, as I said, should be seen as a good investment rather than a cost, because retention of good staff and retention of good working practices, etc., and development of and improving working practices across a range of activities is always great for an organisation, and it can pay commercial dividends in terms of both productivity, staff retention, staff morale, etc., etc. And it, you know, it as with all occupational health and safety initiatives, etc., it should be seen as an investment in that respect. There's a quick question on how can you measure psychosocial well-being and measurement and improve on that. One of the ways would be to look at do staff surveys, perhaps get a cultural feedback on how people perceive the organisation, look at production rates and work rates, how they deteriorate in a particular thing, look at absentee. There's a range of myriads of indicators within organisations that they will probably already routinely look at in terms of indicators for the measurement of the effectiveness of occupational health and well-being across an organisation. There's loads of examples of those sorts of things. Just looking through the remaining of the questions. There's a question from Karen that I may not be able to see because all it says is, can I see my question? And stress and various psychological stresses and psychological well-being and hazards can also come from neurodiverse employees. It can also come from all sorts of cultural and diversity within an organization. So, you know, it should include all those things, and appropriate measures should be put in place systematically across the organisation whilst looking to support individuals. In terms of disabilities and various things, that's also already covered in various bits of legislation, but would also include health and safety legislation, making appropriate adjustments of the working activity and the working risks and hazards in relation to disabled or disabled community members. So yes, it would include all of those considerations. And like I say, certainly within the UK, there's already a legal framework that would touch on all of those, and generically overall, health and safety would be included in that. So I think I've got the vast majority. Now I've got your, sorry, Karen, I can now see your question. If we can't add 45,003 to the scope of 40,001, how can we then demonstrate to clients? Because ISO 45001 is a management system, that's why it can't be accredited and used within your scope of 45,003 can't be used within the scope of that, because 45,003 is a guidance standard. But we can offer verification unaccredited to 45,003, which would then give you some form of certificate to verify to your customers and clients, etc., and to wider interested parties that you're using the principles and activities of 45,003 to enhance your existing arrangements. We have already done that for several clients, Karen, just in answer to your question. So yes, you can get an unaccredited certificate, but you can't put it into your scope of registration for 45,001. Apologies about the questions, but they don't all come in time framed sequence in my questions inbox in this profile. Hence why I'm scanning through, just looking at the time that the question came in, so that I'm trying to put them into some meaningful responses. Anyway, there we go. So it looks like that's the end of the questions. So can I just say thank you all very much for attending the webinar. I hope you found it useful. Like I say, I've given you my email address should you have any direct questions. And like I say, we can't consult, but we can clarify what the standards are looking to achieve and looking at the benefits thereof. I'm not sure whether it's still available. There was available for download a free copy of ISO 45003 from the ISO website. So that's iso.org.com, I think, and you were able to get a free copy of that as a read-only version. So it can be quite useful to have a look at. So good luck to everybody, and thank you for considering 45,003 and enhancing your requirements of 45,001. Hopefully that's answered a few questions. Carry on with the journey with NQA. We'll support you where we can, as much as we can. And as I say, don't forget to register for the next webinar, which is the implementation one. So thank you all very much. I hope you all had a really good afternoon, and keep safe and well. Thank you.